Well, wounds aren't always pretty, but what do you do when your everyday life is battling chronic pain?
Well, it's an issue that a lot of people face, and at Aspire St. Luke's, one patient actually has found her footing. Fox 21's Drew has her hopeful story.
You don't know what you take for granted until you miss it. That's a lesson that 79-year-old Lori Lubiani learned on her journey to recovery.
7 years ago was the first surgery on my foot, and had to fix a crack in my heel. Then they put some metal in there, and the metal had nickel in it, and unfortunately I'm allergic to nickel. So it started kind of a progress of my everything kind of going to haywire. And then I had a second surgery, and they took the nickel out and replaced it. That didn't work.
After 4 surgeries on her left foot and her injury becoming septic, Lori stayed determined to get back on her feet, but she learned the road to recovery isn't always linear.
I ended up having breast cancer and heart attacks. I had a couple heart attacks.
In the last 7 years, Lori didn't let her regular doctor appointments bring her down. Instead, it was her relationship with her nurse that led her onto more stable ground.
I was recommended to come into the hyperbaric chamber. Oh my goodness. I'm like, you really are going to put me in there? And then I saw that they have the door and they're going to close the door on me, and I'm like, oh, I can't even have my head sticking out. And they go, no, you're going to be in the pressurized chamber. So it was quite an experience.
Over 60% of our treatments are radiation related. When you're breathing in 100% oxygen, what it's doing is it's sending oxygen to the blood cells and increasing the white blood cells around the area of the wound, and it's rebuilding the tissue.
Larson said that patients can expect to see results within the first 5 appointments in the chamber.
It has a really high healing rate. We like to couple it with our wound care program. So usually patients, if they're not healing from traditional wound care, then after about 4 weeks or so, that's when they will enter the hyperbaric oxygen therapy chamber.
Now, Lori can walk again, completing 40 90-minute sessions over the course of 2 months. A 2-time breast cancer survivor, overcoming heart disease, managing diabetes, and finally stepping ahead of several years of foot pain, never once losing her footing along the way.
I am very happy. It's one of the best things in my life, and it's like I'm slowly getting there, and I know my family's been very encouraging.
In Duluth, I'm Drew Kerner, Fox 21 Local News.
Isn't it something? Thank you, the doctors.
Yeah, well, and to Lori for staying, like I said, she stayed hopeful. That was the intro to this story. You can't make it through all of the treatment she had to go through and the continuous care and doctor visits unless you stay positive and committed and consistent for your own health. So good for her.